right. First of all, thank you so much, Chris, for taking that time out to speak. My first question to you really is what problems can digital healthcare and technology kind of address within the healthcare industry, mainly within Scotland, actually?
Well, I think we're really at the start of a journey
Okay,
regarding digital technologies. I think we're only really starting to explore the possibilities.
right.
Um, but I think what's clear is that there's benefits to be had for patients, there's benefits to be had for frontline staff, and
Okay,
then there's benefits for leaders and managers and from the point of view of research and development into new medications or technologies as well. So there's
okay,
all sorts of things that we can see. My hope is that it will make patient care more person-centered. So
okay.
patients will have more control, for example, of their own records, of their own data.
Mm,
Uh, I hope that patients will be able to self-manage more effectively
mm,
using digital tools. Um, and I hope that it'll mean that when we talk about the really expensive stuff that the NHS wants to sort of stop doing or do less of,
absolutely.
which is hospital admissions essentially. But can we keep patients at home for longer? Because that's really where they want to be. They don't want to be admitted to hospital for things that maybe technology could support them to stay at home for longer.
Absolutely. Yeah.
So I'm hoping that yes, there will be money to be saved within the system, and I think that's we just need to get that out of the way and say that we need to do that because with the aging population that we have,
Mm,
we can't risk doing nothing. We've got to embrace digital technologies,
absolutely.
and I think that these can help better decision making at all levels as well. So at that
Absolutely.
patient level, at the front line level, but also that more management and strategic level as well about decisions that are, where do we put resource in the system? Do we put it into health? Do we put it into social care? Do we put it into acute services? Where do we put our emphasis? And digital technologies can give us data, can give us information that enable us to make those decisions, hopefully better than we would have done otherwise.
Absolutely. Absolutely. Now, having mentioned data, I think that kind of, takes me on to my next question in regards to artificial intelligence. We've kind of seen artificial intelligence taking over the frontline news here and there and how things are being done with it these days. So how do you see AI having a long-term impact on healthcare, and how would this affect the workforce?
Yeah, well, I think that the workforce is key to all of this transformation. You've got to take people with you, and if the workforce at the front line are going to be implementing a lot of this stuff, then they need to be understanding. They need to have skills. They need to be not afraid. They need to be trusting of new technologies, and artificial intelligence is for all its many forms, it is a case in point because it is a very complex technology that is quite difficult to understand.
Yes.
And so there is that element of workforce and change management that's required.
Mm,
But hopefully we will see things like decision support coming in to play much more. I mean, we know that it's there now,
yes.
but we could see more of that in terms of artificial intelligence being used to make decisions about patient care or to spot things more
Mm,
earlier on,
yeah.
and be more preventative in our approaches. So hopefully we can be making quicker and better decisions.
Mm,
Um, but there's other things as well, like some of when we talk about the voice recognition stuff, that maybe we can be looking at reducing the administrative burden on the front line,
okay.
so that nursing staff, for example, can spend more time on patient care than physically typing in notes and things like that.
Absolutely.
So
Yes.
hopefully we can see benefits there as well.
Yeah.
Um, so across the board, I think there are benefits, but we do need to, if decisions are going to be made, they need to be made on good data.
Absolutely. Data seems to
So,
be the backbone of it all, isn't it?
yeah, your artificial intelligence will not be intelligent if it's not working from decent data sets. So,
Yeah.
so that's key.
Yeah. So having talked about that in terms of the benefits itself, now let's briefly discuss the local information for Scotland. I know it's designed to help the Scottish citizens. What have you identified as the key benefits achieved to date, really?
So ALISS is, as you say, a local information system for Scotland, and it's been running for 14 years as a programme and a web-based system for people to find information about community assets.
Yes.
And so at this point in time, we have in excess of 6,000 services, groups, activities listed on there. So crowdsourcing that information is an achievement in itself, and we know that job will never be done.
Okay.
That will never be finished, because there's always going to be gaps. There's always going to be information that needs to be updated. There's always going to be information maybe that needs to come off there because things change. You know, communities move on, services close down, and so on.
Absolutely.
So what we see from our figures is that, you know, the website itself sees in the region of 10,000 users per month. We have reach into the statutory picture with the NHS Inform website. So ALISS data is connected via an API into the NHS Inform service directory. We have other integrations as well, maybe more local ones. Shetland have just created a community directory based around ALISS. And I think, you know, what we can do is we can demonstrate what good looks like in this space, because, as I say, we have been going for 14 years, so we can talk with confidence about running an open source project like this. We can talk about open data and what that means, putting this data in the hands of the public.
Right.
We can talk about crowdsourcing the information, which is not easy, and we can talk about working in agile means. We can talk about co-producing and putting our users at the center of decision making when it comes to the direction of the program. So there's quite a lot of, it's quite a complex program anyway, but there's quite a lot of learning over the piece now that it is quite a mature program. Certainly compared to, you know, the newest, the latest and greatest stuff. ALISS has been on the block for a while, and I think that it represents something that's at scale and exists as a national digital sort of health and well-being service.
Yeah. So 14 years, that's a very long time. I mean, with that, you can tell that that's literally a proof of concept at any point in time if you were to present that as a solution, you know. But having said that, how easy do you think ALISS as a solution itself can be deployed in any other place where healthcare itself can be considered expensive or requires more organization? Do you think it's an easy thing, having come through that 14-year journey and observation of seeing it being used live across different practice and regions?
Yeah, so there's certain things that could be taken reasonably straightforwardly. Like, so for example, I mentioned the open source factor, and so the code is available to anybody. So in another country, one could take the code, but you'd need to be generating your own data set. And so that's where the learning that we have from the less technical side of the program, which is engagement and promotion. So you'd need to get, I guess, buy-in at all levels into ALISS. So at government level, potentially, there needs to be a commitment to adopting this program, and then you need to be engaging with communities on the ground to say, right, okay, let's populate this, let's make people aware of it, let's use it as a place where you can promote your service. Whether you're a big organization or a very small micro organization, there's a place for you on this system. And I guess, you know, when you mentioned healthcare and the price of healthcare in some countries, ALISS represents a health and well-being resource. Now, some of the resources on there are free at the point of access, so you can just turn up and attend a walking group or something like that. But there is space for paid for services, and But I think what a lot of these resources can offer is an alternative to healthcare.
Yeah.
So you're not necessarily saying, well, this will replace expensive medications or whatever, but what you are saying is that health and well-being is a big picture. And taking a holistic view of people's health and well-being. So for example, how much physical activity is a person undertaking? Do they have access to peer support in their local areas? Can they get advice around their money or their legal situation? And these are all things that you can find on ALISS. Where's my local food bank? Of course. These types of things. So if any one of those things, any one of those areas is deficient, then it can have an impact on health, the health of the person. So we're not saying that there's an alternative to formal healthcare here, but we are needing to look at a big picture, and that's where ALISS can come in. But it does take commitment, by government and by decision makers. So you'll need things like hosting. You'll need things like staff time to support the programme, and we're fortunate in Scotland that has been a long-term commitment by Scottish Government to the ALISS programme. So we're starting from a position of it's established. It could be better established, but it has a momentum to it. So taking this to another country, you'd need to find a way to create that momentum by yourself, I suppose.
Absolutely. Well, thank you for that, Chris. Yeah. Having said that, how would you say doctors and patients themselves can actually practically, I think you mentioned this, but let's narrow down to actually doctors and end patients in terms of their approach to using ALISS in itself. How would they practically benefit from this? I think you mentioned from the patient's perspective, it could be used more like a resource where they refer or join a working group for one thing or the other. Or in terms of doctors, how would they actually make use of ALISS on a day-to-day basis?
Well, if they're aware of ALISS, they can access it directly, or they could refer their patients to it. I think what we've seen in Scotland is that the doctors will handle the medical needs, and we have other practitioners, some of them within primary care. So we have community links practitioners who would look at those non-medical needs and might use ALISS more fully. But what we can do through technology, we can use APIs and we can bring ALISS data potentially into the GP's systems. So that there, as well as prescribing medication, there is that notion of maybe social prescribing and looking at the resources that are on ALISS as an alternative or as a complement to a kind of medical intervention. So doctors, I guess they're not our main target audience, but anybody can use ALISS, and I think that there's clear benefits if they were to do so. But I think that there are associated professions as well, that links workers, social prescribers, other practice staff. So there's the direct route into, visit aliss.org, or we can look at other integrations that are possible through the APIs and things like that. That's stuff that we're trying to explore. Approaching industry partners who are offering services to GPs.
Okay, sounds great. And I think my final question to you is mainly based on policy making. What part did policy making in any way have a part to play in the creation or management of ALISS, most especially around social care policies?
Yeah, well, I think that there's a clear policy direction from Scottish Government, from the digital health and care side of things, to maintain ALISS and to bring ALISS into new programmes and pieces of work. So we can use things like APIs to bring the ALISS data into, there's a programme in Scotland called Digital Front Door, which is enabling a a system where patients can do lots of transactions. They can view their records via a kind of one front door, if you like. And we view ALISS as being part of that, and indeed that's the direction of travel that we'll see. So from a policy perspective, we see ALISS as part of the furniture forward, but also we can influence policy because we have a lot of intelligence about what's going on in communities. So the ALISS data set can be used to influence policy and say, right, okay, so we have a lot of activity, a lot of organizations and groups within, say, urban areas. But when you go out into remote and rural communities, what does the picture look like? Is there equity around what communities look like? And what does the ALISS data set tell us about that? And can, from the Alliance perspective, can we feed back what we're learning through the ALISS program? And that can influence things like social care policy. So, for example, there's talk and proposals moving forward for a national care service. So a lot of the stuff I'm talking about can be fed in through our policy kind of function into the moves towards a national care service. So yeah, I guess it's influence in both directions. The policy has influenced ALISS, but ALISS hopefully can influence policy.
Yeah, I think that's a great response. It impacts and can be impacted. So yeah, so thank you so much for that. So Chris, thank you so much for taking time out to respond to the questions asked, and this has really been quite insightful.